Hello, everybody, and welcome to our series on AI in healthcare presented by InpharmD. My name is Janvi. I'm Director of Brand Development here at InpharmD, and I am so thrilled today to be joined by Dr. Tim Ongst, founder of the Digital Apothecary, pharmacy leader, professor, clinician, public speaker, and advisor. Dr. Ongst, we're thrilled to have you here today. Do you want to start by introducing yourself and sharing a bit about your role in digital health and pharmacy?
Sure. Thank you for having me on today. This is an area that I'm quite passionate about. It's been something that I've been invested in since, let's say, 2010. So I was in last year of pharmacy school, and then I went to residency. And I remember in residency, the iPad had come out, and I actually got an iPad, and I was like processing our orders on the go. So instead of using a workstation on wheels, I was like processing on an iPad. And people are like, what the hell are you doing? And I'm just like, I don't know. It just makes sense, right? I don't want to have to find one of these things. I just can do it here. I was trying to shove an iPad in a white coat pocket though, and that was not an easy thing at the time. But then I started looking at like apps and stuff like that. And I was like, could I use apps to recommend to patients? And there wasn't a lot of information at the time. And what ended up happening was that kind of got me in the whole cycle. It was like, well, what makes a good app? What makes good information? How else can we use these digital technologies? And it was like the whole idea, like IoT at the time, going into, now what some people call Internet of Medical Things is another IOMT is another shorthand I hear sometimes. And start looking at wearable devices, start looking at things like that, and then started being asked to be a thought leader on a lot of these topics. And that's kind of where I'm at these days is I focus on digital therapeutics, digital biomarkers, combination product design, medication adherence devices, remote patient monitoring tools. And I think that brings us down to this is that AI empowers most of this technology at the end of the day. AI has always been in the background for me. It's just never been that quite of a hot of a topic until these past few years, which is quite interesting.
Absolutely. I love that you said iPad in the white coat pocket. I can like imagine that visual and I love that. So talk to me a little bit about what apps or what technologies were you using when you were in residency versus what apps would you recommend clinicians to have nowadays? Like what are okay, this is like a really good digital tool or a really good app that a health system pharmacist or a health system resident should really check out or really make sure that they have on their phones or their iPads. What would you recommend?
So that's tough because this is the thing that always got me is back at that time period, you still had the traditional like drug information handbook. You still had a lot of stuff like that. Now your workstation on wheels, you could go online and pull things, but Epic still hadn't, and electronic health records are still trying to get huge market shares. I think at the time they were still only about 50 to 60%. I still was at health systems that were still using paper-based medication administration or Mars, and paper-based documentation. Actually, even where I was in my residency, still had paper-based documentation, for instance, on a day-to-day basis. So what I'm saying there is that nowadays, for many clinicians, we have accepted that you can go on to your EHR system to document, and there's gonna be a little button that has up to date right there. And having this stuff built into the workflow generally through a web app design has probably been more easier for clinicians to get onto versus the standalone um, mobile app. So there is a differentiation, I think, between web apps versus mobile apps. Um, Mobile apps, I think, have been generally in the population much more successful for patients as a means to access information about themselves and such like that. I think web apps and some other mobile apps, though, I will say, have, though, because of integration into like a one-stop shop designed for healthcare services and workflow is much more successful these days. I mean, I remember when back in that time period talking to people at Walters Kluwer and saying like, when are you going to make a Lexicomp app? And they were like, we don't think we need to yet. This was like back in like 2010, 2011. We're looking at it, but like, what part of the population is going to have smartphones? And I think over time, everyone was like, yeah, we got to make this switch. And that's where we're currently at. Like everyone now has an app or has a web-based app or something like that. And that's become the default. So I would say most of our traditional media that we have trusted, that we've learned through information has digitalized itself. And so this digitalization has occurred. What is different though is how do you go through a process of digitalization then to leveraging the technology to do different things that you couldn't do in the past. I will give the example of banking. You
Mhm.
don't call it digital banking. It's banking. You, I mean, let me ask you this. Have you walked into a physical bank in the past 2 months?
No, I haven't. I have the apps on my phone. You're absolutely right. I don't remember the last time I walked into a bank.
How about cashing a check physically?
I
When's the
mean,
last time you did that?
no, I don't. I can't remember the last time I cashed a check
How
either.
about write a check then?
Oh my God, no. Like it's been maybe cashing a check, it's been maybe months, and I'll use like the app on my phone where you can scan it. But with like the direct deposit and direct money transfer options nowadays, I feel like even cashing checks is like not as popular.
But I draw that analogy because I think that's what's happened is like you go through this digitalization process where people are like, you know, I remember having home economics in high school and being told how to balance a checkbook. I don't balance a checkbook. I still know people who do, but I trust the bank to do that to some extent. And I think that's a cultural thing. And, as some people are just like, yeah, why wouldn't my bank be fine? Versus, now we have people saying, oh, they've been charging you some background fees and you've been actually losing money. And people are like, what? Well, it's these types of things, this literacy, this access. And I think the same thing's gone on for healthcare is that you're seeing providers that are used to CPOE versus never having to write a actual prescription. And I've seen some having to write prescription like, what do I have to put down? What's my number? What's this? And it's kind of like they're hoping that CDSS or whatever, the decision support systems are built into the EHR is going to prevent them from making an error. And they're like, well, now I have to remember this off the top of my head. So you have the digitalization factor. And when I look at from banking is now you have like Venmo, electronic payments that you can do peer to peer. You look back 20 years ago, 10 years ago, and you better have had cash on you to do that. And now you can just with that. So I think that's the leveraging where you go through a digitalization phase to then thinking beyond how to leverage the technology to do things. And that I think comes back to like your ask about, was a good app or anything like that. I think this is where we're seeing the digitalization of most of our traditional resources. But on top of that, we're seeing some companies come on board and basically saying, hey, we went through a digitalization phase, but what else interesting could we do that you couldn't do in the past? And that I think is what's making things very interesting right now, especially for me looking at evaluating some of this stuff coming out.
Yeah. Um, so we talked about AI being integrated with a lot of these digital technologies, and we talked a little bit about the evolution, kind of where we started, where we're going. Can you comment a little bit more on that evolution? Is there anything that excites you the most in terms of integrating AI and digital health together?
Sure. I think there's several sides to that. I'm going to start with like a basic one that most of the audience is probably familiar with, especially if they're pharmacists or healthcare.
Mhm,
Drug information. This is one thing that gets me. So, I just talked about like digitalization process. Like
mhm,
instead of going through a handbook to look up information or drugs, vaccine comparisons or interactions and physically doing it, now you can do it online. You can hit a check down marker that you can say, hey, compare guaifenesin versus, um, another drug. Okay, fine, you can do that. But it's still a lot of manual and cognitive labor to do these types of things.
mhm,
What this is where I think then we get to the next level when we talk about AI. What stops you from integrating AI into a system that can just do that automatically?
mhm,
But what also stops us then from doing also additive things? So instead of going to find me the dose of amoxicillin to give for otitis media for a child under the age of 6 that weighs 40 pounds. Okay, so I'll go into Lexicon and pull out all the information. I have to know which part to look for, what dosing, administration, then I have to physically do the calculations. What stops from our tools from saying, let's slap an AI on it, that you can actually just, all our information's there.
mhm,
You're going to base your information off that. But then with these AI tools, and let's just say it's Gen AI tools at this point, because that's kind of what it is, and maybe some other agents slid in there, but saying like, let's put in a prompt, what dose of amoxicillin to give for blah, blah, blah. So instead of you having to go through and trawl through the information, which is there, it will give you the calculation based on what's with it. That to me is the escalation here, away from just digitalization, but also application of the technology. So that's just on that perspective. I think we're seeing this in other things that are coming up. So digital health perspective for patients, like CGM devices. Dexcom and Abbott have released their own OTC variants. Lingo, and I can't remember the other one, for instance. But what's going to stop people from making other apps that can harvest these measurements and then give like, in advice, or maybe not necessarily advice, but suggestions. As I'm going to try to be cognizant of what the FDA would probably intervene then. But if they give suggestions on what you can do for health and wellness, like, oh, your sugars tend to trend down here low. Do you know what may have done that? Did you eat something or not eat something? And here it's high. What were you doing in that activity and such like that, and help guiding people to it. So yeah, you can give data to people, but data is meaningless without, I think, understanding and the nuance of how do you apply that data. And most people I don't think want to go under the cognitive labor to do that. Again, like balancing a checkbook. Like, yeah, the money's there, ins, outs, and such like that, but I don't want to do the math. Just tell me what to do. And I think that's what people want. So like that's how I think people are leveraging AI technologies, is to take that data capture and apply it in a meaningful way without you having to spend more time thinking about like how to do this. And it's good and bad, I would say, depending on how you wanted to think about that. Um, but I think that's the market demand these days too.
No, I absolutely agree. The market demand is definitely there, and we do see a lot of strides with AI and drug information. I mean, the InpharmD is building, our own tool that can read and sort and transcribe medical literature. And I love that you mentioned, there's the like provider part of the integration, but there's also a big focus on like patient care, or the integration really positively impacting patient care. What are some of the challenges that you see as different companies and different systems work on these integrations? What are some challenges that arise, and how can these different systems and clinicians go about handling these challenges?
So to me, I look at them, they're all multiple stakeholders at the end of the day. And the hard part in healthcare is realizing that each stakeholder doesn't have the same mission at the end of the day. Um, Patients, clinicians, payers, health systems, etc., all look at different things quite differently and want them for different things. And they're not always the same. I think many people come out saying, I want to make a one solution for a problem, but that problem is very nuanced and has different reasons. I'll give an example, like adherence. I always come back to like adherence is one area that I've always struggled with.
Mhm.
You make money by selling drugs at the end of the day. So you want people to take their medications to stay on schedule, because if they do that, then they'll refill their medications and take them appropriately, and you make a sale there. You want to take their medications because it should at least keep them on therapy and treat the disease. But there's a balance. So if you're a pharmacy or an operations, and on that whole side, like you need to encourage sales. So your pressure for adherence is being pushed around trying to make sure people take their medication to make the sale. The pharmacy wants to sell the drugs because that's how we make the money at the end of the day usually. Clinicians want you to take the medications to basically achieve disease treatment. They're not making money off the sales of the drugs. So that conversation around adherence is two different things for those two different parties at the end of the day. In theory, they all meet by people taking the medication, but it's not going to for the same reasons. And then patients themselves may or may not want to take the drugs for different reasons. And that's why we struggle with non-adherence then. So I think I see this because I've seen so many solutions over the years that people are offering some things. I'm just always coming back to is, whose problem are you trying to solve, and recognizing that problem may not be the same for someone else at the end of the day. Those are the struggles I think have always popped up from technology. Um, who's your key stakeholders? Who are you selling to? Who's going to address these things is very key. And I think that's where we've seen some success. I'll go back to CGM development. Um, because I think that's been a big breakthrough in healthcare, is that patients don't want to prick themselves that often, so they're really rapt to get on this. The data from it's very good clinically using, and the data has shown either better outcomes or lower medical misadventures, like hospitalizations due to hypoglycemia due to overuse of insulin. So you've satisfied multiple people there. The payers who are going to pay for, the clinicians who are going to prescribe it, and the patients who are going to want it at the end of the day. So like there's very few things I've seen in healthcare that can align with all these key stakeholders and meet their needs that are very different and drive that. And I think that's the key thing is, when I look at this field, when people come with these things, I'm like thinking to myself, like, is there a problem it's going to solve, and who's actually going to want that? And I've seen people have like decks prepared, and like that deck does not fit the audience. Like that's a clinician deck. That's not a payer deck. Or that's a deck that's for patients, but not for the clinicians. So I've seen things like this and it's always sticks in the back of my head. And I wish that would be something that people would take to heart in this sector is that think about what you're trying to solve at the end of the day. I think that's one of the biggest limiting factors for digital health is a lot of people don't know the nuances of healthcare and they missell. I love some of the products I've seen over the years, and some of them are just like, I would not market it or I would not try to go that route just because I think you're going to have a hard time with that population.
So there's like a strong level of understanding and personalization towards each stakeholder, kind of to better address that integration, those challenges, understanding exactly who you're selling to, understanding maybe that stakeholder's underlying needs. That's really going to help then solve some of the challenges that we see. Okay, awesome. And what about in terms of like regulations? Like AI is pushing so many boundaries, but I think there is a population that believes that there is a strong need for regulation that comes with AI pushing these boundaries. What is your insight on the regulatory landscape currently? Do you think that there are good key standards, or do you think there needs to be better frameworks? Are there frameworks that pharmacy professionals should be aware of? Kind of what are your thoughts on that?
I think regulation's always going to play catch up, and it's always been the case. Um, and then you have the developers on the side that are like, well, we just introduced something to the field that has either really excited everyone or scared the hell out of them. And
Mhm.
we should pause now and see how they catch up and address this. Or we just steamroll it ahead and just deal with the fines and come back afterwards and beg for forgiveness. Like there's different levels that have always happened. Um, so I don't look at regulators as a impediment. I think that they're supposed to be there to help put guardrails on things that just because you can doesn't mean you should at the end of the day. And we have enough things in human society to demonstrate if you don't do that to a normal extent, the nature of building profit or other ethical dilemmas will pop up, whether it's equity, whether it's safety in the end of the day. So I think the regulators, the biggest problem with that is I think regulators struggle from manpower, unfortunately. The people that would you would want to be there are probably going to be hired by the companies that are developing the software at the end. So there's a discord in terms of manpower and expertise across the spectrum. Uh, and I think that's the reason why like it takes time finding people who want to give the time, want to find these experts. And then you have regional versus national versus international. So the United Nations, for instance, I think has released some frameworks or some concepts that they want for AI, and they've been pushing that for the past month. The FDA is convening, I think, four of their organizations, CEDAR, CBER, Connected, and I can't remember the other one, CDRH maybe, together to like start looking at this stuff. You had the current Biden administration. I think that today just spoke at the UN about like there's going to be huge things that are coming out. We have to think ahead. So I think you have all these going on. The issues have probably people are going to conflict. There's going to be people are going to have conflicts around this. What does data privacy mean? Especially we know that internationally, some cultures and some nations that means very different things than other ones. Um, so I don't think we have a one size fit all. I think it's going to be very regional. That puts these developers in a very hard position. Whether or not they're going to be able to sell in certain countries or whether or not they're going to pull out or what they're going to release and what's going to be limited. So bottom line is that the regulations, while is needed, and I fully believe in them, I recognize is there's going to be a large amount of issues there because catching up is always going to be an issue. And then the other thing is that there's going to be differences in different countries, regions due to different factors there. And that I think I put this back down to developers, and they really have to think about, well, where am I going to play? Where do I want to test? And what do I have to keep up with? They can't negate regulations at the end of the day. They just cannot. They have to follow them. And I think everyone's like, well, what regulation should I follow? Well, it, and this is the thing that while you hire, I think, lawyers at the end of the day, because someone's going to say, it depends. What does it depend on? Well, what are you doing? Well, let's talk about it. And now you're going to pay that, hourly fee. But it really does depend, I think.
So, in parallel to these regulatory frameworks, I think there are also ethical frameworks that some people have questions on, right? I think there is a population of people that believe, I have been told that I would rather trust a human who gets it wrong instead of an AI who gets it right. And so I feel like there is one, a shift in thought, and then two, actually, how do we kind of handle these ethical considerations? You mentioned like AI data privacy. If we have AI, integrating with like let's say EHRs or something, how do we handle a ton of this ethically? So two-part question: how do you handle that school of thought that doesn't really trust AI, and then also how do you kind of tackle some of these ethical considerations?
There's an old adage, trust is gain in drops, but lost in a bucket.
Yes.
And I don't think anyone would want to come out with, and it's very far and few between what OpenAI did with ChatGPT was a marketing ploy and a very smart one, but they knew they could get away with it because they think they had enough trust in their product to at least wow the audience. There's very few times that you're going to have someone that wants to wow everyone. It's what I always think with technology is the slow itinerations. Itinerations gain trust, and from trust that you adopt. And that can take years. The one thing I'll go back and my example is from a UI UX perspective is design is skeuomorphism. So you had a flip phone, Motorola Razor going around, and then someone introduces the iPhone. Okay, well there's a clear screen with buttons on it. Okay. Oh, look, there's apps on it. This looks like a Rolodex. That must be where people's contact information is. This is YouTube. It looks like a TV screen. Um, oh, this is a game thing because it looks like a game board. So why do they do that? The whole idea was that skeuomorphism is to take something that people recognize every day and cram it into something that's digital.
Mhm.
You open up the app these days and it's a red triangle for YouTube. Like it looks nothing the same. We are at iOS 18. I think it took us until iOS 10 to get that point. It took 7 years to do that. And over time, you change people's habits, little things. So little itinerations like this. And I bring that up because AI is not going to change this dramatically in healthcare overnight. It's going to be these slow incremental changes. You will have vendors come out saying, hey, we added such and such feature to you. And they've done due diligence. They looked at what people would be receptive for, and people would say, hey, this makes sense. This is good. And then from that, get people used to it, and then you push the bar a little bit more. Then you push the bar a little bit more. And then you look back a decade and go like, I can't believe we used to do this by hand. Isn't it so nice that we now have this?
Mhm.
That's always, I think, been the reality because that trust takes time. I think good companies realize that. They know that if they come out and they try to like destroy the foundations of what people belief is and such, it won't work, or it leads to bigger problems in the end. People will rebel, or they have to be forced against it. And some people argue we're in the fourth industrial revolution. Well, that's fine. Industrial revolutions take time. They don't happen overnight. Like something comes on board and there's a huge timetable of change that will occur. Microsoft Excel came out and you didn't have all these people overnight that were unemployed because they still had to know how to use Microsoft Excel. And some people transitioned out of that career and some people transitioned a career to handle that kind of stuff and like, debit and credit and keeping all this information, blah, blah, blah. So I think when I look at it right now is that we are in that transition phase. And to me, that is going to be the big thing. I think companies are very smart culturally and how to deal with that will do very well. I think these slow, moderate incremental changes for things that people already don't like is going to get more buy-in at the end of the day than be like, hey, I'm going to throw on a AI robot that can diagnose people. Like, no one wants that. No one wants that. But would people be assured saying, hey, we have added like this adjunctive AI bot that can actually detect errors more frequently and can help with the make sure the provider has better diagnosis. Some people might say, I like that. That's
Mhm.
fine. I'm not losing the human component, and now my human will be better. So it's things like that that stand out to me.
Do you think there would be any disadvantage with, or like, I understand that it would be an incremental change over time, but there are people on the technology side that say, it's just advancing exponentially, and that like now so many people have AI, so many people are adapting GPT technologies. Do you think that healthcare or pharmacy would be left behind because of our maybe hesitancy to adopt fast? What do you think? Do you think there's maybe there's an advantage and a disadvantage? What are your thoughts?
We're always gonna be 20 years behind.
Yeah.
Like we're still calling it digital health instead of just saying that's how healthcare is gonna be delivered versus we don't call it digital banking. And they did that back in the 90s. So I would say I accept that healthcare is always going to be behind, and there's multiple reasons for that. Healthcare professionals still own a lot of power, and it's a very much a weird environment. You know, you graduate from a healthcare degree and you enter a workforce and then you learn horizontally. There's no more top down, there's no more didactic and stuff like that. You pass your boards and then you're a practitioner and now you learn from your peers. So it's a very horizontal space. And there's cults of personality and people who will guide that. And that could be where you get training and who you look for, who develops guidelines, who develops best practices. So these key opinion leaders at the end, they do really matter in healthcare. Um, there's very few other industries I think that operate that way. That to be quite frank, it's very hard. So I think healthcare, what you're going to see is that our time, you'll have some people push harder than others in certain therapeutic areas and certain professions, and you'll see adoption go quicker or slower. And some people hold on to the past more than others. And I think that's fine to a certain point. I think patients aren't going to be clamoring over overnight for like I'm going to enroll in a direct to consumer system that diagnoses me with an AI avatar. I You will always get the tech crowd to be like, yeah, I'm being managed by an AI bot, and that's cool, but I come back down to it to make a business. Like that's very bespoke. That's not going like you're not going to see the pukas come out and say, yeah, we're going to enroll that. No, they're not going to do that. That's going to take some years because they're going to want to make sure, does it work? Is there an ROI on this? Regulation again. Like, so all those things slow it down. And you're gonna have people who be like, yeah, I made an AI bot that can like diagnose or write prescriptions, blah blah blah. And someone's gonna call it out or they're gonna skate under the radar and get some PR from it. But to me, it's like again, like it's a very small thing that can call attention to what could be done and maybe what we can move to, but we're not quite there yet.
What would you recommend to uh, healthcare individuals, pharmacists who want to maybe stay on top, not be left behind? What are some tools? Are there maybe I don't know, any blogs or uh like YouTubers or anything that you follow that you think would be a like good ways to stay abreast of AI information, kind of the AI evolution in healthcare, just for those people who are kind of that tech focus, they want to stay a little bit more up to date than maybe the general healthcare population.
I would say embrace change and curiosity is very key right now. Trying to figure out what is feasible and not, and balancing on what does, the future of our workforce look like. Like I can't imagine that in 20 years anyone wants to drive through a drive-through pharmacy and wait for their medication, or we're going to go into a pharmacy and wait 10 minutes, 15 minutes for their med.
Mhm.
I don't think that's how healthcare looks in pharmacy looks in 20 years. So what does it look like at that time period? And what's the transition to get there? That may be the job that you can help develop and push in, or think about where you want to work at. I think a big thing with AI tools, even as they give more responsibility, is QI and QA, whatever you want to call it, is going to play a significant role. These models drift, they hallucinate, blah, blah, blah. Things change. How do you update it? How do you train them? But you're going to need some people there in the background to maintain that. And that's going to be the fact of the matter, is that there will always be some human element present. At what scale? That may depend, to be honest. But those are the types of things that consider. So like what does data mean? How do things work? How do you operate? How could you use them? How could you make sure that they keep working? Like I think those are very interesting areas that people will be able to drive a niche out of for themselves. So who's going to provide this information? Oh, that's a hard one. That is a very hard. Um, there are some organizations looking at this. So we have our traditional HIMSS, we have our traditional American Medical Informatics Association. I would say it's the tech people, then informatics would probably be the closest to this stuff because to be quite honest, the topics and issues around informatics came out of AI 40, 30 years ago. It's always been about data and data computation, how to handle this stuff. So it's nothing new for them. So, but a lot of that's very technical. But if so, unless you're very technical inclined, it may not be the best place, but they would probably be the best ones for that transition. Beyond that, thinking about the clinical utilization and things like that, some of the AI companies are popping out like certificates and knowledge sets around like what AI means and blah 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 like that. I feel like a lot of them are just trying to get you up to date on the the language, the jargon, the applicability, or whatsoever out there. So they may be worthwhile for some people depending on how nascent they are to these topics. As to like what to do and how to do, I don't think anyone's figured that out yet. I can't point to someone and say that, hey, that's the content that you have to read and understand in order to do this. I think it's still evolving. Um, so I won't point to anyone right now to say like you have to take that certificate, you have to take that training, and that will guarantee you a job. Like I don't think we're there. But there's some things in the background that people are looking at that could be potentials, but it's going to be very niche at this point.
That's awesome. I'm really excited for the future, and excited to see how AI continues to evolve, and how it integrates with pharmacy. That was my last question for you. Do you have any last parting thoughts on any AI trends, digital health trends, anything you want to leave our audience with?
I think the next few years are going to be fun, and scary. You know, that it's always been like someone says like it's a curse. May you live in interesting times. Like that's not always a good thing. But I don't think any point in human history has not been interesting. Right now, I think we're going through a big transition period. I think the flaw anyone could say is right now they're comfortable in their job and saying, my job will not change in the next few years. I think if you do that, you'll be set up for failure. I think the nature that for most healthcare professionals is they have to think about, well, how does healthcare change? And where do I fit into that scope and preparing for that? Um, Possibly, I could see in the future there being a great change within like pharmacy education is that as operations change, as the business change, there might be a need for a great retraining for pharmacists to still maintain viability within the changing work environment. So that's probably something I would throw out to everyone is that think about what industry you're in, what's the possibilities for adoption, change, and what do you do to keep up with it? Don't be complacent. I think that's a very scary thing right now.
Yeah. No, I couldn't agree more. I sometimes working for a startup can be, very challenging. We're all suffering together, but being kind of on the innovation side of it and seeing all the cool innovations that are going on, I like, and battling that complacency, like you said, I remember that, and it is definitely a lot more rewarding and a lot more interesting too, just to kind of learn and see what's going on. But Tim, this is awesome. This is such a great chat. Thank you so much for joining us today and sharing your insights on AI and digital health. It's been a fascinating conversation.
Oh, thank you for having me. Hope it helps out for everyone else too.
Thank you. And to our viewers, thank you for tuning in. Be sure to follow us for more exciting discussions on the future of healthcare and AI. Stay connected with us on our socials, and we will see you next time. Thank you.